Carcinoid syndrome leads to pellagra-like manifestations. Carcinoid syndrome is caused by neuroendocrine tumors that secretes excess amount of serotonin. The symptoms of carcinoid syndrome are flushing, diarrhea, and wheezing. Pellagra is a niacin deficiency disorder. Niacin is vitamin B3. The symptoms of pellagra include dermatitis, diarrhea, and dementia. So these are famously known as 3Ds. If left untreated, the fourth D, that is death, will happen. Carcinoid syndrome is due to excess serotonin. Pellagra is niacin deficiency disorder. What is common between these two? Can you think what is common? Niacin and serotonin, they both are produced from same precursor. What is that? That is tryptophan. Tryptophan produces serotonin as well as niacin. 60 milligram of tryptophan is equal to 1 milligram of niacin. All right. So, niacin is not essentially a vitamin. Okay. In carcinoid syndrome, what is happening? All the available tryptophan is diverted to serotonin synthesis. Right? So, because of this, what is going to happen? This conversion, tryptophan to niacin conversion, is inhibited and the level of niacin becomes low. That is why carcinoid syndrome leads to pellagra like manifestations.